Everybody, can you hear me? Yeah. Good afternoon, everybody. And I would like to start by thanking the organizers for giving me the opportunity to share some data with you on the use of antimicrobial dry cow therapy in the Finnish dairy herds. And as we've heard in many presentations and lectures already during this conference, antimicrobial resistance is currently considered one of the biggest threats to global health, food security, and development today overall, and And WHO, World Health Organization, has even mentioned, used the term post-antibiotic era. So for that very reason, there's been a lot of calls for prudent use of antimicrobials, both in human and veterinary medicine, as well as in agriculture in general, and there's been lectures on this topic, talking about the resistance and trying to find ways of reducing antimicrobial usage. And when we think about dairy and antimicrobial usage, there's one disease that pops up above all, and that's mastitis. And it is the most common and costly disease in dairy herds, and for that very reason, it is also the most common reason for antibiotic usage in dairy production. And therefore, prevention and control of the disease is crucial. One of the tools that we use commonly to try to control mastitis in the herds is dry cow therapy. And it is, in fact, the cornerstone of many and most mastitis control programs. However, while it is widely accepted and widely used, the way how it's implemented varies from country to country. And there are countries that have been promoting total dry cow therapy for a long time, and that's where all quarters of all cows are treated with antibiotics, regardless of whether they are infected or not. And then on the other hand, there are some countries that have been promoting the use of selective dry cow therapy, where only the infected cows or those that are suspected to be infected would be treated. And as we've heard, there are several lectures, presentations in this conference on selective dry cow therapy. So clearly the movement is almost globally, I would say, towards reducing antimicrobial usage by switching over to selective dry cow therapy. Finland, along with the other Nordic countries, have always had a very strict antimicrobial drug use policies for food animal production, and antibiotics are only available through veterinary prescription, and in addition to that, veterinarians are actually not allowed to make profit from drug sales. And we know that dry cow therapy is not commonly used in Finland, and it's limited to selective dry cow therapy, and we have the milligrams of antimicrobials sold in the dry tubes, but we don't actually know how they are used on herd level or cow level. There's no official data collected on that. So in order to find an answer for that, the objective of the study that I'll be sharing with you today was to survey the Finnish dairy producers to describe, first of all, the drying off practices, and then the use of antimicrobial DCT or dry cow therapy in Finnish dairy herds, and look at the association of the DCT use with herd characteristics. And then furthermore, the goal is to evaluate association between these drying off practices and then other health parameters and production parameters using the dairy herd improvement data. So in order to do this, all Finnish dairy herds that are in the official dairy herd recording system, or the DHI system, which is about 5,500 dairy herds, and the producers of the largest Finnish dairy processor, the large co-op in Finland, were invited to participate in this survey. And with this sampling frame, we actually covered about 80% of all Finnish dairies. So an online questionnaire with closed-ended questions were developed, and those questions were related to the general herd characteristics, the herd facilities, drying off practices, and specifically those related to dry cow therapy. And this questionnaire was open between January and May 2017, and if somebody wanted a paper copy was also available per request. In order to try to maximize the response rate, we followed the Dillman survey guidelines in the sense that we first sent out an introductory letter with the help of the DHI Association and the dairy processor, using their regular communication channels, email, the producer intranet, as well as producer letters went out with the milk trucks to the farms. And this initial data that I'm presenting to you today was analyzed with SAS using simply chi-square and Cochrane-Armitage strength test. And then also with the Dillman survey guidelines. After the introductory letter, several weeks later, we sent another email with a link to the survey, and then after that, or sent out a paper copy if somebody had requested that, and then reminded the producers 3 times with 3 additional emails about 2-3 weeks apart to try to increase the response rate. So here are some of the results. We had 715 dairy farmers who responded to the survey, so that is about 13% response rate. Obviously, we would have wanted to have a much higher response, but that's pretty typical for this type of surveys. And also, we were quite glad that the herds that responded were very representative of the Finnish dairy industry in general. The answers came, relatively speaking, they came from all across the country and in relation to the herd density in the different areas. The herd sizes were small. About less than a third of the herds had more than 60 cows, and 22% of the responding herd milked their cows in automatic milking system, so they had the robotic milking there. 23% of them had a milking parlor, so freestall barn, and majority, 55% of the herds were tie stalls and did milking with a pipeline milking. And regarding the drying off practices, in 96, almost all, 96% of the farms, cows were dried off gradually by changing the ration to reduce the energy content and by reducing the milking frequency in order to get the milk yield down before the final milking at the end of lactation. And here are some of the results regarding to the use of dry cow therapy. And as you can see from this pie chart, majority of the responding herds, which is 78% of them, reported to be using selective dry cow therapy. And of these farms, also majority, 71%, said that they treated only up to 1/4 of their cows with antibiotics at dry off. Then there was 9% of the herds that said that they didn't use any dry cow therapy, and there was a chance to make comments, and several of them commented that they didn't feel like there's any need for it, that the udder health in the herd was good enough that they didn't need to use DCT. But 13% of the herds actually reported to be using total dry cow therapy, so they were treating all of the cows. And of these farms, 60% of them said that they have been using this approach less than 5 years. And most of these herds, about 2/3 of these herds, said that they had switched to total dry cow therapy due to deteriorating udder health and or based on the advice of veterinarians. And this is probably related to the fact that there has been a reemergence of Streptococcus agalactiae in Finland, so the prevalence of contagious pathogens may have been increasing the herd, and veterinarians had advised dry cow therapy treatments at that point. So one of the arguments against selective dry cow therapy in countries where they've been using total dry cow therapy for a long time is that there's no really reliable and cost-effective method of identifying which cows should be treated and which can be left without treatment. So we wanted to ask the Finnish farmers that how are they actually doing this? How do they decide which cows to treat? And somatic cell count and mastitis history was used as a criteria in most herds, in 95% of the herds, to decide which cows should get treatment. And of these responding selective DCT herds, 83% also said that they tested milk samples microbiologically from at least some of the cows before they administered the antibiotics to the cows at dry-off. And a little over a third of the herd said that they actually tested all cows taking milk samples and tested them bacteriologically before dry-off and before giving the antibiotics to them. And what was actually quite interesting in this is that even in the total dry cow therapy herds, about almost two-thirds, 64% reported that they test at least some cows before treatment, just to know what bacteria is there, even though they had already decided that they're going to treat all cows. And this slide actually shows some of the associations between DCT and herd characteristics. And we can see here that there was a significant trend between the use of total dry cow therapy and total dry cow therapy use increased with increasing herd size. And also the use of TDCT was more common in the automatic milking system herds compared to the pipeline milking or the parlor milking herds. And obviously these two characteristics are very closely related and are, the AMS herds in Finland are the larger herds, and the small herds use pipeline milking. And then on the other hand, the not using DCT was clearly associated with the smaller, more common in the smaller herds and with the pipeline milking herds. So the results of this survey actually showed that, confirmed the fact that what we thought is true is that selective dry cow therapy is very common in Finland. And we also saw that the Finnish farmers collect a lot of milk samples and test them microbiologically before they give antimicrobial treatments. And this is probably along the guidelines that they've been given and according to the guidelines of the Finnish Food Safety Authority that says that we should have a bacteriological diagnosis before using antibiotics. The interesting trend here was, however, what we observed was that the use of total DCT was increasing with increasing herd size, and also it was more common in automatic milking systems. And as I already mentioned, this is probably partially related to the fact that Streptococcus agalactiae has re-emerged in Finland, and we know that dry cow therapy is very, very effective in controlling it, and that's probably the reason why the veterinarians have been recommending it. So at this point, we are still continuing the data analyses and try to explore the associations also with the DCT use and other health and production parameters in these herds. But all in all, I can say that the level in milk quality in Finland is very high. For example, last year, the national average SCC was under 130,000 cells per mil. And it's been on that level below 150 for a long time. So that's a clear evidence that production of high-quality milk is possible with selective use of DCT. So maybe that's just some sort of comfort to those of you who are actually trying to move towards that direction. However, given the trends that we noticed, I think that the continued monitoring of DCT use and also education of farmers and veterinarians are warranted to maintain this good situation and make sure that we continue on this line of prudent use of dry cow therapy in Finland, as we've been doing for a long time. And with that, I would like to thank you for all your attention and would be happy to entertain any questions or hear your comments.